I'll be your student nurse today. Is it okay if I do your postpartum assessment? Okay, I'm just going to put on some gloves to begin. I'm going to start with some vital signs. First, I'm just going to ask, do you have any pain? Can you rate that on a scale of 1 to 10? Okay. If it gets any higher, just ask your nurse for some medication and to help with that. Okay, so I'm just going to start with your temperature. Okay, open your mouth. I'm also looking at respirations. Good. Okay, respirations are about 16, temperature is normal. Check your blood pressure. What is your normal blood pressure? Good. Blood pressure is normal, 120/60. I see you have your IV site on this arm as well. Do you mind if I look at that really quick? Okay. It's clean, dry, intact. Do you have any pain with it? No? Okay, good. If you ever discover you have some pain, you want to let your nurse know because you could have some issues with that. So I'm just going to start by listening to your heart, lungs, and your abdomen. Is that okay? Good. You pull back your top a little bit. Deep breath in through your mouth. Good. Good. Okay. See your lungs. Good. Sounds good. We'll see your abdomen. All sounds are active. Sounds good. Have you had a bowel movement yet? No? Okay. Well, you want to make sure that you're taking those stool softeners that are offered in morning and evening. That will help with your bowel movements. It's normal to not have one for a couple days after giving birth. Also, make sure you're drinking plenty of fluids, eating fiber, and getting up and walking the halls. That'll help with that. So is it okay if I assess your breasts? Okay. First off, do you have any pain, tenderness, warm spots, or any hard or soft spots? No? Okay. Are you breastfeeding? Okay. So if you're breastfeeding, you want to make sure you use warm compress if any of those things start to occur. Are your nipples intact? Any cracking or anything like that? No? Okay. So I'm just going to palpate your breasts in a circular motion. Feeling for any lumps, warm spots, tender spots. Let me know if anything hurts. Okay. Nipples are intact. Got a little bit of a lump right here. It's kind of hard. I can bring you some heat for that, help soften that up. Good. Do you have any problems breastfeeding? No? Okay. One thing just to educate you on is when you're breastfeeding, when you want to unlatch the baby, just gently put a finger inside the baby's mouth to break that suction. That will cause less pain for you as well as the baby. Okay. I'm just going to assess your uterus now. How has your bleeding been? Has it been heavy? No? Okay. That's good. I'll just feel for it and then I might educate you a little bit on it. Two-hand technique. Uterus is midline, firm, and it's 2 finger breaths below the umbilicus. So if you notice that your uterus ever feels soft and your bleeding's a little heavier, you might massage your top of your uterus called the fundus, and that might help with the bleeding, and you'll notice that it firms up the uterus, it will contract back to normal size faster if it's firm for most of the time. Okay, I'm just gonna look at your pad. When's the last time you changed it? An hour ago. Okay, so I'm just gonna take a look. So you have some rubia lochia, which is just normal bleeding after giving birth. I would say you have a moderate amount. Looks good, no presence of clots. Okay. You want to make sure you're changing your pad every couple of hours at the very least, because it will help with infection control as well as helping us assess better your bleeding amount and if we need to intervene further. So I'm just going to turn you on your side. I'm just going to look at your rear and your incisions. You had an episiotomy, correct? Yes? Okay. Just going to look at your stitches there. Just gently roll you to the side. Okay. Did you have an epidural? I see a Band-Aid back here? Yes? Okay. I would pull back the Band-Aid to see if there was any signs of redness, edema, ecchymosis, drainage, or if it was approximated. No signs of any infection. I'm just going to look at your rectum here. There's a couple hemorrhoids, which is common after birth. They can cause some irritation and pain when you have your first bowel movement, so make sure you're taking those stool softeners. Episiotomy looks good. I can't see stitches, which is normal. It's approximated. No redness or any other drainage besides the lochia. Pull this back up for you. Okay. Just going to assess your legs for any signs of clots. Do you have any calf pain currently? No? Okay. I'm just going to talk to you as I feel your legs. I'm palpating for any warmth in one leg that's unilateral, any edema that's in one leg and not the other, besides just the normal pregnancy swelling. I'm also checking for if you have any pain that's in one leg and not the other. Your legs look good. You deny any calf pain, so that's a good sign. If you develop any pain in your legs that's outside of the normal just soreness, you want to let your nurse know right away. One way you can prevent any clots in your legs is to get up in the halls and walk around. That can also help your bowels. So I would also check her incision site. If she has cesarean, I would check this for Rita, so any redness, ecchymosis, edema, drainage, or if it was approximated, I would make sure if the dressing is still on, that is clean, dry, and intact. I would also educate her about after the 24-hour period, if she's showering, she might take off the dressing then because it's easier to take off. I would also ask her about her bladder. I would make sure she's voiding every couple of hours. If there's any burning sensation or anything like that. You could educate her on if she has any burning, use a squirt bottle, spraying front to back to help if it's burning around the episiotomy site and stitches. I would also tell her that if there's any burning actually when peeing and not by the incision site, that she could have a UTI and that she'd want to let her nurse know right away.